Hi, I'm Anjee Davis. I'm the president of Fight Colorectal Cancer. We are in March Colorectal Cancer Awareness Month. So we are so excited because this is a celebration of over 1.5 million colorectal cancer survivors and their families. And it's the month that the White House recognizes it and people from around the world, around the country rally, wear blue, and raise awareness around colorectal cancer, which is highly preventable. So I think that as we think about, what happens when a patient's diagnosed with colorectal cancer, they're focused about their treatment options, their family, their jobs, and how they're going to navigate sort of the next day. And so as we start talking about, how do we use and empower this data? How do we work together to address this? It really is an industry issue. That's why advocacy groups have to work with partners like Komodo, like hospital systems, academic centers. Our job is to make it easier for them, not to ask them to do more, but so that when they go and they meet with the doctor, it is seamless. They're getting the best care no matter where they're at. And I think that's the key thing that we need to remember. I think it's so important that we represent the communities that we're serving. Black and brown communities need to tell their stories, and we need to encourage each other to be screened, to fight for our care, to ask our doctors questions about how we can cure colorectal cancer around clinical trials, treatment with biomarkers. And I think that's the one thing, and I think Komodo did a great job of highlighting the importance of health equity and the service and treatment that underserved communities are receiving. 5 years from now, my hope for Fight Colorectal Cancer is to play out our Path to a Cure report. What we're trying to do is convene the smartest and brightest across industries around colorectal cancer through etiology, biology, prevention, screening, treatment, survivorship, and reoccurrence. And what's important to us in 5 years is we want to have the best and brightest working on colorectal cancer, and that it's no longer a disease that's stigmatized. Fight Colorectal Cancer started our 1 Million Strong campaign really because we heard from our advocates like, I'm not into advocacy and I'm embarrassed. And we're like, well, what can we do? How can we empower survivors? And I was in Washington, D.C., and a stage 4 colorectal cancer survivor was on the steps of the Capitol. And she looked across a group of survivors and she had her arm up like this. And she said, yeah, let's go do it. And I said, that's it. It's our strong arm selfie. And I loved it because as soon as she did it, I get goosebumps whenever I picture her, but survivors in the crowd started doing strong arms and they were taking pictures, and we really saw that grow from 10 people doing it to over 50,000 people did it, I think, last year. And the reach of our strong arm selfie is incredible, but it's empowering, and it's not just for survivors anymore. It's for caregivers, it's for kids, it's for friends that get to say, I'm in this with you.